Good morning, I'm Bianca Barzaghini, a second-year PhD student in bioengineering at Politecnico di Milano. I want to thank this scientific committee for giving me this opportunity. My project is focused on 3D scaffold named Nichoid, which is optimized for human adipose-derived stem cells, in order to develop a more efficient stem cell therapies. In particular, my work is focused on spinal cord injury, which causes temporary or permanent loss of function, of mobility and feelings. Unfortunately, spinal cord injury affects 9 million of people in the entire world with a cost of $100,000 a year per patient. Currently, there is no cure for spinal cord injury. The patients are supported with therapies to limit pain and with technologies as exoskeleton to support the limitation of paraplegia and tetraplegia. But in the recent year, a new approach is becoming more relevant, the regenerative medicine and in particular stem cell therapies. This approach is focused on possible recovery that gives a new hope to patients. Several research groups study embryonic stem cells and induced pluripotent cells in neurodegenerative disease. Despite interesting results in the animal model, the transition to a clinical phase in human is generally blocked by public medical agencies due to the risk of teratoma and tumor formation and the use of chemical agents to avoid spontaneous differentiation. Our approach is totally different. We want to improve the beneficial effect of autologous stem cells. These cells are harvested directly from a minimally-invasive liposuction of subcutaneous tissue, adipose tissue of patient, expanded in vitro in our scaffold, so in a 3D microenvironment, to obtain a consistent number of cells to guarantee a therapeutic effect, and then reimplanted in the same patient, limiting the immune acute response. In 2012, Professor Raimondi started to study a 3D microscaffold named Nichoid, which mimics the microarchitecture of stem cell niche. The goal of this scaffold is to maintain or even increase the stem cell potential and ensure a better therapeutic effect. Nichoid are fabricated by two-photon laser polymerization using a photosensitive and biocompatible resin. This engineered niche has a precise geometry of the pores and it's optically accessible. Thanks to this isotropic mechanical stimuli in feeder-free condition, without the use of chemical factors, this niche permits to maintain a pluripotent state of the cells grown inside the niche, and in particular with neural, embryonic, and rat mesenchymal stem cells. This is the new experimental setup for the microfabrication of the nichoids, optimized with the introduction of spatial LED modulator. The device splits the incoming laser source in several parallel beams, decreasing the fabrication time. The generated beams are collimated from the optical path up to the objective that allows a punctual polymerization of the sample. And the sample is mounted on piezoelectric translators that control X and Y axis motions. After the fabrication, I expanded human mesenchymal stem cells inside the graduated pore nichoids. But unfortunately, several cell detachment protocols did not allow a proper cell detachment, and 90% of the cells were trapped inside the small pores. This is a crucial step to collect cells for a future transplantation, so require a further investigation. The solution is to enlarge the structure of the grid. A new niche, called cubic niche, is therefore designed, whose elementary pore measure 30 by 30 micron and 60 micron in height, which are comparable to the dimension of these big human cells. These were the optimal parameters that I found. The most important is the power of 140 milliwatt, which creates the scaffold in only 2 hours of fabrication. The single block is repeated on the glass cover slips with an area of 8 mm in diameter. And before the use, I sterilized the sample with ethanol and UV exposition. In the first step of biological validation, I grew human adipose-derived stem cells for 7 days in standard condition and inside the new cubic nichoid. In these immunofluorescence images, the red markers represent vimentin, which is the major cytoskeletal component of mesenchymal stem cells. We can observe a difference in morphology. In flat condition, the nuclei are elongated, while in cubic 3D reconstruction, the nuclei maintain a spherical shape. I then evaluate the nuclear aspect ratio, that is the ratio between the minor and major axis of the nucleus, and I obtain a value close to 1 for the cubic nichoid, indicating significantly more spherical geometry. And this confirms the hypothesis that the cubic pore Nichoid induce an isotropic cytoskeletal tension. From literature analysis, a spherical nucleus corresponds to pluripotent states. So furthermore, as reported from Amaki et al., the activation of the marker octamer 4 is also connected to an undifferentiated state. Both these aspects are present in my experiments, the measure of octamer 4s, but also SOX2 in cubic Nichoid results upregulated. And this evidence shows how wholly mechanical isotropic stimuli from the niche could induce a pluripotent states in human mesenchymal stem cells. As cells are pluripotent, they are able to differentiate better and respond more effectively to induce external stimuli. Since the study deals with the spinal cord injury, I decided to differentiate the cells into the neural commitment, and at first the cells were expanded inside the cubic niche, effectively detached, collected, and then differentiated for 10 days to simulate inside an in vitro culture what could happen after a cell transplantation in vivo. Then I marked the cells with beta-tubulin third, shown here in green, which is a neural marker for cytoskeleton. The expression is significantly higher in the cells previously expanded inside the niche with respect to the flat control. I observed the same trend for MAP2 marker here in red, that is the neuronal cytoskeletal protein that stabilizes microtubules, and it's an excellent marker for neurons. This evidence suggests a better plasticity of the cells in response to external stimuli. So to sum up, we optimized the structure of cubic pore Nichoids, and we performed the consequent validation with a biomolecular and confocal microscopy approach. We can assert that this new geometry is suitable for the expansion and characterization of human mesenchymal stem cells. In future, we want to perform a deeper analysis of the entire genome of these human mesenchymal cells expanded in this scaffold and begin to set the protocol for stem cell transplantation in preclinical animal model of spinal cord injury. To conclude, I want to thank all my colleagues, and in particular Professor Raimondi and Dr. Carelli, to give me the opportunity to work on this beautiful and challenging project. And thank you all for your kind attention. I'm glad to answer to any of your questions.